Hello, my name is Ines Aristegui. I will be presenting today on behalf of this beautiful team that you can see on the screen. And thank you for the organizers to giving us the opportunity to share our experience designing and developing an electronic health record according to the Argentinian gender identity law. I coordinate the unit of social research and community engagement at the research department, and this has been a collaborative work in Fundación Huésped. Let me introduce we are a non-for-profit organization with regional scope. We work on sexual and reproductive health and with focus on prevention of HIV and other um, uh, sexually transmitted diseases, infections. In this way is that Fundación is a clinical site for the Caribbean, Central and South American Network for HIV Epidemiology called CASANET. And in this way is that we basically represent the region in HIV cohort studies. This places us, as many other healthcare institutions, in a situation where we face new challenges in relation to how to collect and document information of our patients' gender identity in the health records in an appropriate way. Why we mention appropriate? Because we know that gender and social names is not always included in health records. And this places, on the one side, transgender individuals or gender diverse individuals in situations of vulnerability and discrimination. And this has a cost for the health of the participants and for the society in general, because 40% of transgender women, for example, in our country, avoid going to healthcare settings just to not having to go through the situation of being called by a different name. But it also has other costs in terms of research and epidemiology that, for example, if we don't collect the information properly, we don't have a proper knowledge or an accurate knowledge of medical information of these patients. We know that respecting people's name and gender identity is essential to provide high quality and patient-centered care. And international guidelines usually suggest two steps question methods, but that is to ask for sex assigned at birth and also to ask for gender identity. But but sometimes this is not enough, because there are also local or regular regulations and norms. In the case of Argentina, we have a gender identity law passed in 2012 that allows people to freely develop their gender identity, and you can change your ID, name, and gender assigned at birth just with based on the self-determination principle. You don't need any sort of approval, non-medical or justice or governmental approval. And based on that, the National Ministry of Health issued some guidelines that claimed the healthcare system to respect people's name and gender identity in just the physical environment, in the way that they will be treated, but also in all registration documents. And regardless, and respect this identity, regardless of if the person has changed or not their ID. And this sometimes is not that easy to solve, because there are also some other norms that, for example, in which you need to focus in the ID. So it places the system and the healthcare system and people who work there in difficult situations, but of course this is very detrimental for the healthcare of transgender people. So what the objective of our work will be to describe how the process we went through to design an electronic health record called RedClean for us, that complies with the law, but also with the transgender needs of transgender people. Sorry. So we conduct three um, three. We conduct our work. Sorry, that is a mixed method work in three phases. First, we conduct a diagnosis, a situational diagnosis. We went for, as everyone, for literature review. We conduct evaluation of our norms. For example, the Ministry of Health at the same time require people to notify some diseases, but you need to put the information of the national IGs. And this is one of the things that for us was important to consider. And that's one of the idiosyncratic things that we consider that is important. And we also conduct participatory workshops in where, for example, some physicians, HIV physicians, staff from the clinics, also transgender peer navigators or social researchers, different people were involved to provide their opinions, to explain their needs, and also to see how they were able to comply with all the requirements. Then in the second phase, this information was analyzed. There also some consensus on the information we need, and we establish what we need to meet that requirements in terms of gender information. Next, it comes the phase of designing a prototype, so a multidisciplinary team. Sorry, I'm so stuck today. A multidisciplinary team was working on generating different prototypes on how to visualize that information, because we understand that part of the problem is not only the information, but is how to the interface of this information. So the resulting Red Clean includes different sections with structured information. This system allows clinic staff to register and records all the information we need. That was the consensus was on social names to respect people's identity, legal names to respect some requirements for prescriptions or notifications, gender identity to properly treat the person, sex assigned at birth to properly have information, health information, and legal sex, that was also a requirement for notifications. And in terms of usage, it was very comfortable because useful, not comfortable, because it allows to search patients to patients search be performed by social names and legal names. So this is the way in which data is collected. So as you can see, we can collect legal names, social names, gender identity, sex assigned at birth, and legal sex. Just to let you know, all the information in the picture is fictitious. It's just to provide an example that you have all the different parts here. But the important thing is that this is how data is visualized in the header. So social name is in big and bold font. Initials of the legal name, as you can see on gray, they are in a small way. And well, this is information of the person, the national ID, and a national code that is formed with the information of the person that is needed to notifications and prescriptions, for example. So in this way, we understand that we can prevent mistakes during the clinical visit, not only in the way that we will call the person, but also we all see the same information. Presented in this way is easy for the physician, because physicians don't need to ask ID of the person to do a prescription, and just to be in this missteps when we do all the procedures. And gender identity in this way is respect, not only when we name, but in how we represent their information in screens and on the documents, because it goes through with the social name. So what we have is a revised electronic health record that we believe that it will help us to reduce missteps in data collections, and it will allow us to deliver a proper health service. And we also understand that it will be a very good way to have data or count with data that will better allow us to have a better study and understanding of the health problems of the LGBT community. In this case, we will present the example with trans community, but some issues may arise in this way with based on sexual orientation and things like that. For us, this was an experience that represents a compromise between identified needs of the transgender community and the usability of the system. This is important for us because it's not that it's just a final and only version. We understand that it's a compromise to do things and being able to implement. So this is our main conclusion or take home notes, that we believe that medical informatics has to address the need of gender diverse populations or other populations by designing and developing information systems that allows, in this our case, to gather precise and accurate data, but that this data will be aligned with social changes and also recognize legal changes that are particular for a society and in a particular way, in a particular moment. So it's not stuck, as I said before. And in terms of our own experience, we believe that a clear communication of gender identity in this interface, in this way, Red Clean is expected to improve healthcare delivery of transgender people in our own context. Well, thank you very much for your attention. This is our acknowledgement to Casanet for support this work and this opportunity. And well, I will be open for questions. If you need to contact us for further information, here is my email address. Thank you very much.